And so that's been helpful. So the demographics are changing. And so the numbers in the hospitals are looking good. And when I say good, better, every week they're getting better. And I think even today, based on the numbers that I saw, we have hospitals, well, 2 weeks down to 1,600. Now we've got to work very hard to reduce the community spread, okay? Reduce the community spread, because we're still reporting over 1,000 cases positive, every day. The number of deaths are too high. And so we need to work to bring that community spread, those numbers down, hence the citation and the possibility of getting a ticket. But I think that explains it. Dr. First?
Yeah, first, when I came up to speak earlier, Mayor, I go right into my report. So I too want to express my condolences to the Pacheco family. Gary was a paramedic of ours, and I know his family is feeling the pain. When I say family, I mean his immediate family, but also the fire department family, and the paramedics and the EMTs, the firefighters, all are feeling that pain. So my condolences to his family and his families. And so, to your question, you're right. There's a bit of a conundrum. The good news is that the hospitalizations are coming down, and it's for the reasons that the mayor pointed out. The hospitals are getting better. The medical staff are coming to understand this brand new illness. The technologies. Fortunately, there's no magic bullet cure. There's remdesivir being used, and it seems to be helpful, and some steroids are being used in new ways that they weren't being used in the beginning, so technique with an existing drug is improved. But we are also seeing that the number of new hospitalizations is going down. We had seen that the average age of the people who were infected was coming down. So it had peaked several weeks ago, months ago really, at around 53, and then it got down to about 34. So that's about almost a 20-year decrease in the average. Now, actually, as of Friday, it looks like it may have started to tick back up a little bit again. So that may just be a little bit of statistical wobble. But what my fear is that everybody's seeing good news and taking their foot off the brake. That's my fear. And so we need to not let that happen. Now, if the average age of people testing positive does start to go up again, then unfortunately, I think we can fully expect the hospitalization numbers to turn around and start going back up again too. But remember, the hospitalization's a lag. So we may still be reaping the benefits of our good efforts a few weeks ago, but we have to keep it up. So we'll see. We're also looking to see if there are other reasons. We've got the epidemiologists with the city and the county working together to just make sure we're not missing something, because, as you point out, you would think that those numbers would be in parallel, and they're not necessarily in parallel. So we're trying to make sure we're not missing anything. But right now, that's the best we have.
Are all test results, including PCR, rapid antigen, antibody, and molecular tests, currently being reported to the state health department? If no, why not? And does this skew the overall scope of the actual situation in our area?
That's the other tests that can be done are the antigen tests, and the CDC and the state have not changed yet to want to get those. Now, in our community, that doesn't make a huge difference because there's not a lot of antigen testing that's going on. There is some, and there will be more as time goes on, but at this point, they're still accounting for a very small percentage of the number of tests that are being done. So I don't think we're seeing any skewing of our overall data. Remember, I've always said, don't look at any one number, but look at the way the numbers are changing, the direction they're going in. So there is a little bit of misinformation here, but I don't think it's impactful for how we're interpreting the data. And then the other tests are the immunoglobulin tests, and I find those to be very inaccurate. And in addition, if you're immunoglobulin positive, that doesn't necessarily mean that you have any immunity. So those are not being requested by the CDC or the state. I don't expect that they will. At some point, they may start wanting the antigen test, but as of yet, they're not asking for those.
Okay. And if not all results from all types of testing are being reflected in the state's COVID-19 number, should folks only get tested from those to be more official?
The most accurate tests that we have out there. The problem with them is that the turnaround time of getting your result back, depending on where you go, can be as little as 48 hours or sometimes it's 10 days or more. And that's frustrating, and the state and the feds are working to bring that long time, the 10-day one, we're trying to get away from those labs and make that shorter. And that will happen. The advantage to the antigen tests is that you generally get the answer pretty quickly. The problem is that they are not as sensitive to positives. In other words, if you're early on in your infection, you will likely get a false negative because you've tested too early on. And then they also, and that's actually a fairly large, it can be as much as, the conservative estimate and the more liberal estimates say it's as much as 30% of false negatives. That's the problem with the antigen tests. But when they're positive, they're generally pretty accurate, but unfortunately you have to have a fair amount of virus at that point.
What steps are being taken to prevent technical malfunctions with systems keeping track of COVID-19 cases across the state?
That's why I let you answer.
Yeah, and without knowing exactly which systems you're talking about, and across the states, that sounds like that's a state data level question, and that may be relating to the fact that over the weekend, the state didn't report deaths on Sunday, I believe it was, because they're shifting over. And this goes to what we talked about, I believe this goes to what we talked about last week, is they're changing the part of the reporting for the deaths. It used to be that you needed to not only have the death certificate, have COVID on it, but in addition, you need to have a positive test result. And so they're no longer requiring the positive test result. So there's, neither of those two ways of counting is 100% totally accurate. You're going to get a little bit of undercounting if you look for there to be a positive test result, because sometimes people can test false negative, and other times people have clearly got the disease from a clinical standpoint, but they never got tested, so they wouldn't be counted. This way you may get some overcounting, and then if you go by the clinical diagnosis, perhaps somebody died of something else and the clinician didn't get a test done, and so they thought it was COVID, and if you knew 100% of the information for it. So I don't see there's going to be a little bit of inaccuracy both ways, but again, what have I been saying? Don't worry about any particular number, just look to see which way the trends are going. That's what you need to pay attention to.
Okay. And to press, were you aware that rapid results COVID-19 antigen test data hasn't been included in statewide COVID-19 test reports? Do the Houston Health Department and Harris County Public Health receive data from these rapid result tests, and is there any plan to include those results in city case totals going forward?
And perform. Again, it's a small percentage, and it's not my decision, it's not our local decision. That'll be a CDC and state decision if they start counting them. It wouldn't surprise me in the least if at some point that they do. I think that their concern is the accuracy of the tests, but we'll have to wait and see what they decide. And we will follow the national standard.
Okay. From Houston Press Media. Last week you talked about a decrease in the amount of people going to get tested. Can you provide a little more detailed numbers on last week or two compared to a month ago? And do you have any thoughts on why this may be happening?
We actually had a graph that showed the decrease in the number of folks going to the testing sites. And it's been fairly remarkable, the number of the drop-off. We were maxing out at our two stadium sites at 650 people per day each for quite some time. And it's dropped down to less than half of that. And I see they're trying to find it, but it's dropped off less than half. And your question is a good one. The problem is I don't know how to get the answers to why, because how do you find the person who was going to go but then decided not to ask them why they didn't go? We can talk to the people who came and ask them why. They'll tell us, but that doesn't tell us why somebody chose not to. So it's conjecture. So my fear, and this is complete conjecture on my part, but my fear is that people are hearing the good news coming out of the hospitals and thinking that, oh, we don't need to worry about it anymore. And that's what has me concerned, because that is not what that message should be. We still have way too many people currently in the hospital, and even our positivity numbers, while they're improved, and that's today's good news, is the positivity numbers are down. But they're down to 17.6%. We need to have those down below 5%. So we're still way too high. And we've used the analogy of a school bus to remind people we want to get the schools open again, but the school bus is still going way too fast. This is not the time to take our foot off the brake, even when we've got some good news. And thank goodness we finally got some good news, but it doesn't mean it's time to take our foot off the brake.
About how HPD officer will enforce the new order starting today.
Sí, es importante que ha pedido que las autoridades en el estado municipales empiecen a dar multas por no ponerse la máscara, y el alcalde anunció hoy que inmediatamente los oficiales del departamento de policía, si lo encuentran sin máscara, le van a dar una advertencia, y si no obedecen la orden van a tener una multa que le van a dar de $250. Así, ¿para qué va a perder $250 en esta época con tantos problemas económicos póngase la máscara, no se busque el problema. Al fin del día vamos a mantener la seguridad, la salud pública por usar esta máscara. Si yo la uso, el alcalde la usa, el jefe de los bomberos, el médico, todos usamos, todo lo demás tienen que usarlo, especialmente la comunidad hispana, que es la que está más afectada con los afroamericanos por este virus.
Complaints. But when we're out there and we're patrolling and we encounter people who don't have their masks on, we will give them the initial warning. If they still don't comply, then they'll get the citation or the ticket at $250. Now, I didn't quite understand when he did that hand gesture like that. I really did like that, you know. So,
That was don't waste 250 like you said earlier.
yeah, that was, you know, don't waste $250, put your mask on and keep the money in your pocket.
Word in Spanish, pretty quick, please.
Es que tristemente hemos perdido un segundo bombero al coronavirus. El bombero Jerry Pacheco es un veterano de 17 años, ha estado en el departamento de 17 años y tristemente murió esta mañana, pasaditas a las 5 de la mañana, de complicaciones del coronavirus. Jerry también tiene un hijo que es bombero aquí con el departamento de bomberos de Houston, Justin, y tiene otro hijo también, Jesse, y su esposa Jeanette Rodríguez. Y les mandamos, como decimos, nuestro más sentido pésame a ellos. Nosotros hemos tenido el departamento de bomberos, ahorita tenemos 130 personas en cuarentena, bomberos en cuarentena. Hemos tenido 31 bomberos que son positivos para el coronavirus ahorita actualmente. Y en total hemos tenido más de 218 bomberos que han estado positivos por el coronavirus.